Welcome to the RD2BE podcast. Each week we sit down with a different registered dietitian nutritionist to showcase the diversity of opportunity in the dietetics profession. Our aim is to dismantle the notion that there is a traditional career path. I'm Carl Barnes, the registered dietitian behind the scenes of RD2BE.
And I am Jenna Warnock, the RD2BE host. Our RD guests share their stories, career paths, and advice to help students like us succeed in the profession. This episode is part of our mini-series featuring the Accreditation Council for Education in Nutrition and Dietetics, otherwise known as ACEND. We are creating this series to clear up common confusion and misconceptions about ACEND and its relation to the Academy of Nutrition and Dietetics, as well as the Commission on Dietetic Registration. We're also in a super transformative phase of dietetics with a new master's degree requirement, dietetics application process, and ACEND also created some new Advanced Practice Doctoral Standards, where understanding these topics are crucial for pushing our profession forward. Join our conversation with Dr. Rayane AbuSabha. She's the Executive Director of ACEND, and in this series, we're going to discuss what ACEND is, their new standards, and what steps you can take to uplift and advocate for our profession with these standards. Welcome back to another week of the RD2BE podcast. My name's Jenna, and I'm your RD2BE host, and we're continuing the series where we're sitting down with Dr. Rayane AbuSabha, who's the Executive Director of ACEND, to go over a lot of great information about what's changing in the dietetics profession, ways that you can be excited about becoming a registered dietitian, and all the different and unique pathways that you can become a registered dietitian, as well as the different degree levels. So we've talked about, the application process, the master's degree, salary, negotiating, in your job interviews, all bunch of wonderful things to become the best dietitian that you can be. And so the next conversation that we're going to have is covering the new Advanced Practice Doctoral Standards that we'll be introducing in ACEND. And we're super happy to have Dr. Rayane AbuSabha covering what this will look like. It's still in the works. They're still kind of fleshing some things out, but it's definitely another option for those who are interested in higher level education and wanting to get better pay and advocating for yourself. And so thank you so much again, Dr. AbuSabha, for joining us and talking all about this new exciting thing that ACEND has in the works.
Thanks, Jenna, and thanks for having me. Very happy to be here.
Of course, it is always a pleasure, always, always. And so the first question that we have is I'm sure that this may be a question that some people have, especially with a master's degree being a new introduction now. They're like, okay, so why are we talking about doctorate programs now? And so when and why was the Advanced Practice Doctoral Standards proposed?
Yeah, that's a good question. So we were approached by the programs that already have practice doctorates. But we have maybe 4 to 5 programs in dietetics and 2 more outside dietetics, and 3 of them came to ACEND, and they requested that ACEND develop standards for these doctoral for the doctoral degree. One of their reasoning is they're very concerned about the entry-level doctorate. Like if you're working on your dietetics degree, and then the doctorate is with your dietetics degree, and then those are one. So you graduate as an RD at the same time you're an RD and learning all the dietetics at the RD level, but get a doctorate degree. That's entry level, like your entry level master's or degree. They were concerned about that versus the DCNs, which are really the higher level. You have to have a master's, or you have to have the RD to enter those. So it's a higher level program. It's not entry level. It's not teaching you what you learn in dietetics. It's a higher level content. So they really wanted to make sure that there's that separation, that they are accredited, because there's, of course, accreditation provides a lot of assurance to the public and talks about quality. So they wanted to make sure that they're accredited. So that was how we're like, okay, now we have to consider the doctorate standards. I mean, it's always in the back of our minds, but we never seriously considered it. But the environment that we were in when they approached us, how they say everything has to be at the right time, and be right. It was where ACEND was noticing that many of our program directors that are running our dietetics programs were not doctorate level anymore. A lot of them only have their master's degree, and we're watching master's degree faculty lead and direct and advise students going into a master's degree. Most universities, you need somebody at a higher level to be teaching. So the master's degree person can teach a bachelor's degree, but they should not be teaching a master's degree. You need a special permission to do that. And there's a reason for that, because you want the faculty to be at a much higher experience than the students, so that they can guide them and advance them and help them develop. And so we noticed the need. We now over close to 60% of ACEND programs have a master's level program directors. So where the number of doctorate individuals is shrinking. Only about 2.4% of dietitians have doctorate degrees, a very small number. If I tell you it's close to 3,000 people, that is it. That is very concerning. Jobs that were being put out, posted for faculty positions, were staying out months at a time. They couldn't fill because there's not enough doctorate level individuals to get these jobs. So I mean, there was a need. It was a crisis that we're getting into a crisis mode. The big thing that concerns me is now, with the retirement of baby boomers, we are going to lose even more, because the majority of these individuals holding the doctorate degree are the baby boomers. We're going to be losing more and more of them. And what's going to happen to dietetics research? Do we want to continue to let medical doctors do our research and nurses do dietetics research? I don't we need way more research in dietetics comes from dietitians about dietetics topics. It annoys me no end when I see the MD published on dietetics topics constantly instead of the RD. So we were having a lot of issues with that. Research is not advancing as far because we have lack of doctorate. The profession doesn't advance because lack of doctorate degrees. The leadership is suffering. So it just is a crisis waiting to happen. And I think we're really coming to the edge of it. And because of this, ACEND felt there needs to be a rush to develop these doctoral standards.
No, definitely. And I agree. And something that I was thinking of as well before segueing into the next question about the differences between the different doctoral degrees, when it comes to thinking of, I guess, the grassroots of the issue of why aren't more students applying to doctorate programs and why aren't more students seeing that as an option, do you have any insights as to where that's coming from or where the issue is stemming from, just out of curiosity?
Oh, absolutely. I'm going to have an insight on everything. But yes, I don't know if I'm 100% right on this. But from what I see, when you have done a PhD yourself, you start seeing PhDs in your students that are PhD material. For example, if I think of myself as a faculty, the minute I would have a student that I'm like, wow, this student loves to learn. They're so bright. They're really excellent. I can see they love research. Then I sit them in my office and I start prepping them. Have you thought about a PhD? Have you thought to advance? Why are you stopping at a master's, right? You are pushing your students far because you know the benefit that doctorate degree gave me. And so I want to see that benefit on the other students and I want to advance my students. Does somebody with a master's degree even think to do that? I don't know. They might, and I'm sure we have some, I know we have some amazing program directors with master's degrees that are just so forward thinking and phenomenal. But I would beg to think that probably the more doctorate degree faculty are going to be pushing students more. Just so you know, you're in academia. Jenna, you're in a PhD program. If you're in academia, your faculty, what are they pushing you to do? To become a faculty. Everybody wants you to be like them, right? It's the same. You go into academia, you're like, I'm going to work out, I'm going to be in the hospital, I'm going to be in business. And then the faculty keep you feel like you're disappointing them if you didn't end up in academia, because that's their expectation. They want to produce people like them. I think PhDs and doctorate people will encourage people to get PhDs and doctorate. But if you only have a master's, the likelihood of you encouraging your students to go for a doctorate is smaller. So I think with the erosion of our doctorate level faculty, I think we are getting less faculty pushing the students to go for a doctorate. Here's an example. I was at a meeting with CDR the other day, and I met this, oh my gosh, phenomenal graduate student. I don't know what you want to call her, because she had a master's degree, but she was telling me that she wanted to go for a second master's degree. I was like, what? She's like, yeah, I'm just applying. I want to do a second. I'm like, you are the smartest human being I have met. And why are you wasting another master's degree? Why are you wasting yourself? I said, no, you go for a PhD. You do not stop at the, I said, forget it. It's going to take you 2 to 3 years to get a public health master's. I said, that is a time you spend on your PhD. You get paid for it, right? You get advised. And then the world becomes your oyster when you get that PhD. So, but clearly her faculty never thought to that is something strange, and never thought to advise her to that a second master's degree could be almost a waste, and you should get a PhD instead because you're trying to advance yourself. So that is a big deal. And I sometimes also wonder, is maybe that the our culture now these days, where education is like too much money, too much time. I see it in my children. It's like, they say, wow, I'm going to be 25 and I'm not in the workforce, I'm losing out. And I'm going, I didn't enter the workforce till I was 30 and I never worried about it. I loved it. But there's that urgency that they need to be working, they need to be making money, and that maybe that doctorate, that idea of that a 5-year long stint is too much. A DCN is a 3-year long, that practice doctorate is only 3 years long, but maybe for students now, some people might think it's too long of a time. So there's a couple of reasons, I think.
Yeah, no, definitely. And I think you brought up a lot of great points. And the reason why I kind of wanted to dig a little bit deeper into that is in case someone was listening and they maybe had those concerns, or they were maybe thinking of those things where they're like, oh, a PhD or a doctorate or any terminal degree is just out of my reach. And just because of what they're surrounded by. But I think you bringing up the idea of needing to feed, offering another form of a doctorate, I think is very helpful for feeding more people into that cycle. So then you have more people in doctorate positions, educating the future of the profession about more doctorates, and also having more different types of terminal degree options. It also rids that stigma that a lot of people believe towards, because yes, I am pursuing a PhD. There is that idea that, oh, you're just going to be stuck in academia for the rest of your life, where even I've been grateful to know that that's not the case. It's quite literally what you said. The world is your oyster when you do have any sort of terminal degree. It's just what you make of it. But I think having more an advanced practice doctorate as an option in dietetics can be really helpful. And you'll describe the differences as well. But having a different form of a doctorate can be helpful as well in dismantling those, I guess, stigmas and stereotypes towards a traditional doctorate degree for those who may have not even seen it as an option, but it may be something that works for them. And so if you kind of don't mind now segueing, I think that's perfect segue into distinguishing between the differences in those doctorate degrees that students could be aware of in case they're interested, like the difference between doctorate in clinical nutrition and then the PhD, and then talking about that advanced practice doctorate.
Yeah, absolutely. So if you think about it, you've got the associate degree, then the bachelor's, then the master's, right? And then you have your practice doctorate, and then your PhD. Those are but you can go from a bachelor's to a PhD directly. You can go from a bachelor's to a doctorate directly. You can skip the master's, and definitely to get to that PhD, you don't need to do the practice doctorate or the master's. But in terms of the rigor and the experience and the quality and all of that, that's how it ranks. The applied doctorate is what its name says. It's applied research. applied topics. So usually it is in a focused area, nutrition and dietetics, right? It is it's going to teach you the field of nutrition and dietetics. Probably goes advanced medical nutrition therapy, advanced leadership. It's just going to go a little bit higher level. On these, maybe some of them may have clinical focus, some of them may have leadership focus, whatever. And then you go and take the courses. So you've got plenty of courses to take. And then at the end of these practice doctorates, you usually have a residency or, just 3 month stint or 6 month stint or some type of residency to get some practice at a hospital, wherever you're interested in, to get a little bit of practice because it's very practical. And your research becomes practical research. That's a huge difference, right? You can do a practical research like you can do at you work at the hospital, you decide to do a applied doctorate, and you can do your research on your patients. You can do some patient satisfaction research, whatever. So the research project is smaller. The analysis and of the research is smaller. The statistics you use a lot more limited. The research projects usually probably takes 6 months. Very limited research, but you get exposed to the entire gamut of research, but on a small tidbits because you're not expected to be this research expert when you get out. The PhD is at a different level, and Jenna, you're going through it, so I don't know if my time is like what you're going through. I know things have changed. But the PhD, you're going to start and take your coursework because you have to take coursework. That's a requirement. Some PhD programs will require you to take maybe 40 credits, but others, it's about 2 to 3 courses, depending on the university, on the topic, on what it is. I know, for example, my son is in astronomy. He only had to take 4 courses. So depending on the on the topic, and that's seems to be something that how astronomy goes for their PhD, that they only need 2 to 3 classes, maybe 5 classes max, and then it's all research. The rest of the PhD, once you finish your coursework, right, it is all research. You get a group of advisement. I did 4 years of research. And your research projects has to be original research projects. So it's an original idea. Or it can be like secondary data, or you're using what's available, or you're repeating research that was done. You have to come up with an original research idea, and then you're conducting the entire research on a focused topic. You become the expert, number one expert on that topic. And then you conduct a full-blown research. I applied for NIH grants. I mean, you apply for grants, you get what you can. I didn't get accepted, by the way, but these are the things that you have to do. You apply for grants, you do research, and you spend 2-3 years in academia working on research. And then after you finish the PhD, if you want to be a faculty, most often you have to go for a postdoc, which is an experience. You get paid for it, very little, but which is an experience after the PhD too. So you cannot do that from a practice doctorate. You don't get that postdoc from a practice. That's a PhD level. But only if you want to be a faculty, you might want to decide to do that. So there's the difference where your project can be 6 months. You do it in a practice doctorate while you are studying your courses. And you have a residency often where you're just like getting some practical experience somewhere, versus the PhD where you're spending 2-3 years on a research project, full blown, has to be very high-end research. So I always say you don't have to be incredibly smart to have a PhD, but you certainly have to be very stubborn just to get through it.
No, exactly. And if I'm not mistaken, like another whenever it comes to the work-life balance of both, or just work balance, with a PhD, you kind of eat, sleep, breathe, repeat the research, what you're studying, what you're reading. Whereas with that applied doctorate, from what I've seen online, especially with the DCN, you can complete it online while you're working. Is that correct? Or you can do it in tandem. So there's some flexibility with that. Because I think something that may be churning in other people's minds is similar with a PhD. Yes, you're paid, but it's not great. And it depends on the assistantship where you go, of course. So payment can be a little flexible. Whereas with the advanced practice, they're like, oh, with the residency, am I paying for that? What's that like? Yes, there's that payment aspect, but you can still work. And there's that benefit as well. And so kind of going more into the DCN and then the advanced practice doctorate, where does that fork occur? And kind of, we have the DCN already established. And so what's the advanced practice? Who will it be geared towards?
So all the DCN programs are the ones that came to us.
Mhm.
So we made standards for, we call the practice doctorate standards for those DCN programs and for any new programs that are applying. So from now on, anybody who goes through a ACEND accredited practice doctorate, then they will be able to use the term DCN. And it could be, doctorate in clinical nutrition or doctorate in community nutrition, right? You could do the DCN, whatever you want to name them, based on your field. But I do want to agree with you, Jenna, about with a practice doctorate, you can work and you can do them online and you can do everything while you're working. And you can do them slowly, and often your job will pay for them. You have to pay for your practice doctorate, but your job can pay for it sometimes, or pays portion of that of the courses. So it's usually a 3-year program, but it might take you longer if you're working, you have a family, busy life. PhD, it is a lifestyle. But I don't know about you, stressful life, but the best years of my life. It's fun. You are working for yourself. You are advancing, you are promoting who you are, you're getting more leadership, you're just becoming a different level of a thinker. And yes, you're not paid a lot, but it's a great life. Some of us, after time goes by, that's how we think. Yeah, maybe I can't afford to go to the nice restaurant or something, but man, everybody in the university is poor, and we're all like living it together. And it's it was. I think some of us who have had it never thought that it was not worth it.
No, I absolutely agree. And I'm glad that you kind of expanded on it too. And when you say that your job will pay for it, it's in the sense of the hours that you can work towards your job, that money can funnel towards that education and things like that. And how, if you truly, similar to a PhD, I feel like the stubbornness is across the board, is if you really want it, you can most certainly get it. And you kind of already talked about it a little bit about who this applied doctorate would be geared towards, but similarly to with the PhD, you can go into education, you can go into industry. With a PhD, there's a lot of flexibility as well, but it's mainly geared towards academia, of course. Whereas you've talked about a little bit with the applied doctorate, it's more, application based, just higher level of thinking in a workplace setting. And so, where would you see someone with a DCN working? Where do we kind of see this entering the space as?
Yeah, I'll tell you where they are working now. A lot of times they're in, leadership positions in hospitals, definitely in departments of health. They're in some of the leadership positions in the Department of Health. We have a lot of them love to teach, so they come in our faculty. They cannot go, most often they cannot do um, the I'm trying to think, like, they cannot become full professors, they can't do that tenure track, but they can do professor of the practice, something like that. Many beltway, I'm just going to say these for-profit research institutions might hire them. For-profit institutions that are not organizations that are not research, they will hire DCNs. But most of the ones that I know are doing. We don't have that many yet, right? Like 80, we don't have that many. But most of the ones I know are either faculty or working in hospitals in leadership positions.
Awesome.
But there's so much. I mean, I think even myself coming out of my PhD, I was executive director of spinal cord injury board, executive director um, of breast cancer research board. It doesn't have to be nutrition all of a sudden, because your expertise now is so wide and big. You can do so many leadership things. I worked on a lot of the enhance research, and we were there working with the IT people on enhance. You can do so many things that are just not related to nutrition.
Yeah, and you already kind of were mentioning the benefits, but if you don't mind diving a little bit deeper as well, if someone is interested in the advanced practice doctorate, what that benefit would in particular be to dietetics, which, because you mentioned how even having a terminal degree, it opens up so many doors. But then, for those who are thinking, oh, but if I really want to do that tenure track professor, I need a PhD, but I don't really want to go through that. But so then they're looking at the advanced practice doctorate. What benefits do you think could really sway someone to applying for an advanced practice doctorate in dietetics?
Yeah, a lot of the benefits, some of them are tangibles and some of them are intangibles, right? And I always feel like for me, the intangibles have been the most important thing. They they've 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 you know they just make things so much easier for life. Um, One of the great benefits is now you're the expert and you're the highest person in the room, right? Some of us like to lead, don't like to follow. And if you're one of those people who likes to lead, you want that doctorate degree, because is going to allow you to be the leader in the room. Certainly, that's what you do. Very big. You're going to have a lot of jobs that open up to you in dietetics, but they're going to open up outside. All of a sudden now, you're outside. You can search outside dietetics because the jobs market opens up wider. Because now you have a doctorate degree. So now you're looking at leadership, you're looking at critical thinking ability, you're looking at administrative, already now people look at you differently. But also, if you're somebody who likes to learn, who is a lifelong learner, you certainly can be that way with a master's degree. But certainly, having a doctorate degree teaches you. It trains you. It like puts it in your blood how to read research, how to learn more, how to find out information. The benefits are just immense. I mean, I'm a big proponent. I tell you, with my students, I did not let them leave my room without talking to them about a doctorate. The minute I see that you've got it in you, I'm going to push you to get it because the benefits are great.
Yeah, and I think another thing too is not only the job flexibility and opportunities, but also the job flexibility and schedule. Because if I'm not mistaken, when it comes to you having a doctorate level, you put in so much hard work to get to that point. It opens up flexibility for, and you can correct me on this, but I do feel like when it comes to hybrid remote or when you do go into an in-person place, it's more managerial and in the sense of broader scope. So you're not picking at the weeds or doing that kind of grunt work. It's more so because you're at a higher level of education, and not just education, but that higher level of thinking that you're learning and the more transferable skills, you're able to manage and run things without necessarily, having to be the one dotting all the I's, crossing all the T's on, the groundwork. And so do you have any insights when it comes to the flexibility of the modes of working as well with a doctorate degree and what that can look like?
Yeah. I think the DCN, if you're not in a university setting, most likely will end up taking the 9 to 5 job look, unless you're working for yourself. But most likely, I mean, you can be a DCN and you can go be a consultant and do very well as a consultant. And now let's say this: you're not consulting to do nutrition counseling, right? You've got that doctorate degree, you're at a higher level. Now you're consulting with universities to help them set curriculum programs. You're consulting with Aramark or with leading projects on major think tank kind of projects. So these are you're already at a higher level. if you're not consulting, I think if you get the practice doctorate, it's probably a 9 to 5 job, but a lot of people function very well in the 9 to 5 job. I think the faculty position is the position where some DCN can do faculty. A lot of universities now, because of the shortage, now they're accepting the doctorate degree, practice doctorates anymore. They're like, we can't find PhDs in nutrition. We'll take a practice doctorate. They're going and changing the rules at the university because they're so desperate for doctoral programs. Being a faculty is one of the hardest jobs anyone can do, right? Hard, but boy, one of the most fun, most rewarding, and greatest job you can do. You're working 50-hour weeks, 60-hour weeks sometimes, but you work them on your own time, right? I used to go Fridays with my kids, spend the whole Friday with my kids, and I'd be working from 7:30 till 3 in the morning because I worked Friday with my kids. So you can adjust that, but it's your own time. So there's a different lifestyle. I think practice doctorates is more structured, whereas the PhD, and if you're going to go into academia only, I worked at Department of Health and it was a 9 to 5 job. But if you're going to be in academia, that's a job that's a lot more flexible. But it's a hard job.
Yeah, and I do appreciate you because while this episode is primarily covering, the changes with ACEND's Advanced Practice Doctoral Standards, I think it's still good that we're covering different types of doctorate degrees that say that we are talking about the advanced doctorate degree, and a listener's like, that's not really interesting to me, but we're still mentioning a PhD as an option because, again, that 2.4%, we want to bump that up, and whether it's the advanced practice doctorate or the PhD or any of those types of terminal degrees. And so I am glad that you're providing your own insights as having someone with a PhD. A little selfish for me because I'm going through it right now, but also for those who may be interested as well, just so that they're getting the full scope of what they can expect if they're interested in either or. And
Jenna, before we move on, can I just quickly say, don't expect that you're going to be hired in a hospital with a PhD to do clinical. It's not as, I don't know that I've seen a lot of them. Unless you're in a clinical research hospital that's doing clinical research, yes. But to be with patient care, I think the DCN, if you want to do patient care, more likely you're going to get the DCN. I don't think I've seen PhDs doing patient care. So just think, if patient care is your passion, I'd say the practice doctorate might, patient care, research with patient care, that practice. If you want to work at a hospital, but you want to be part of the research team at the hospital, PhD, you probably can do it with a practice doctorate, but certainly PhD is where you would do it. So again, both of them have little different jobs sometimes too, different positions.
Yeah, and I think that segues really great into when in someone's career would this advanced practice doctorate degree be considered? And is this something that, given that you will need experience as a dietitian to apply for the DCN program, is this something that should be planned far out? When we look at current DCN graduates, do you have insights into what their process was for what made them decide to get a DCN? And just if someone is interested in this, when should they start planning it? Just kind of insights into that whole process.
Yeah, I think often, we allow in our standards, we allow the practice doctorate program to accept a student with a bachelor's degree and 4 years of RD experience, or students with a master's degree and 2 years of RD experience. So you have to have been an RD for 2 years with a master's degree, you can do the DCN. And every program can make the rules. Like, let's say, one of the programs may decide, we don't want to accept bachelors, we just want masters. The programs can make the rules, but those are the minimum standards that ACEND will accept. We're not going to allow a program to take a bachelor's degree student who only has 3 years RDN experience. That we will not accept. So they do have a little bit of experience. You've already worked, and you're like, I feel like I can do more. Or, wow, I see this research team, I want to be part of that research team. Or I'm looking at all the job market and I'm seeing all these jobs that require doctorate terminal degrees, and those are the jobs that interest me. So you can, these are the decisions that make you change. Some of us think about it when we were little. I was a freshman in college when I said I want a PhD. So some of like you know what I mean? Some of us know that's what we want to do from day one. So if you know, don't let it stop you. Go get it. It's the best thing you can do. But some of us, some other people might take time. You know, you might be working on your job and you're like, you know what? I love my job, but it's not satisfying me. I want more. Or you may say, wow, my job pays $4,000 a year to take courses. I want to work slowly and advance myself. You know, so there's many different reasons to take that to move on for that doctorate degree. You know, so there's just a lot of, I think I lost the train. I have a thought, but I lost the train of thought. If I think of it, I'll say it next. But you have to know when you want it. But I always say, if it comes to your mind, if you even think it, you're ready to do it. If you're like thinking, go, wow, maybe I should get a doctorate, then I think you are ready. And you should consider it and pursue it and think about it.
Yeah, and
Yeah.
train of thought.
Oh, I was just gonna say, and we have and that's that last one. Many faculty get it because they work in universities, they have master's degrees, they're surrounded by doctoral degree people, and they see the benefit, or they see the benefit to their students. We have a lot of faculty who go for the DCN because they are at a university and they want to advance themselves.
Yeah, and I just like from my personal experience, because I initially went into my program with a master's degree because in the back of my mind, I was similar in your shoes where I always saw a PhD as something on the horizon, but I didn't feel ready in a sense. And so I started with a master's degree, but with a thesis option, so I would still get research experience just to dip my toes. But once you're in it, and then you're surrounded by these people with PhDs, and you're surrounded by these people who kind of elevate you, and they see you and they're like, what are you doing? Because then they're able to actually see you from outside in instead of, we kind of get caught in our own headspace so much about because I felt like, oh, like too young to get a PhD. I need to get some real life experience. I need to actually get out into the workforce and then come back. And the best piece of advice I heard from someone while I was kind of going back and forth between staying in the master's degree or going to the PhD is they said that you can never plan for what you think you will be thinking in the future. You can only plan for what you're thinking in the now. And if you think about a PhD, if you are thinking about getting a PhD now, that exactly to what you said, that means you're probably ready to pursue a PhD now. And that really helped me with the decision-making process because again, I feel like what stops them from doing certain things or pushing themselves to that terminal degree is that they feel like they're not ready. They need to get more experience, which again, with the DCN and with the advanced practice doctorate, you do need a certain level of experience, but what's nice is it's spelled out. And, but if you wait years, decades, or things like that, just because you feel like you're not ready, if that's the only thing that's holding you back, but you still want it, why not just try and, just explore and push yourself up and things like that. But
yeah, you're never ready. You just have, you're never ready. You just have to do it. And you do it piece by piece and slowly. And the role of the practice doctorate, the role of the PhD is to get you ready. So you're never going to be ready to have that practice doctorate, to have a PhD. That's what the faculty are there for, to make you ready. So, but yeah, if you think about it, you're ready for it. If you don't think about it and you're like, no way, then not. But I'm telling you, the minute it comes to your mind, then you should put it in a plan to pursue.
No, most certainly, yeah. And as far as the last kind of question when it comes to looking at the advanced practice doctorate, I think before we kind of segue into the conclusion of just the final words of what's better to get, DCN or a PhD at the end of the day, when it comes to the timeline, as far as just kind of an update of where is ACEND at with the advanced practice doctorate and where are we currently at as far as the pipeline goes?
Yeah, great idea. Great question. So we published them, we released them last year. And since we released them, we have some programs that are applying. So already we know that some of the doctoral programs out there, the practice doctorates out there, they're all planning to apply. And then we've had some new ones apply. So soon we'll have a few of them. You know, it takes accreditation, it takes a long time. So we have to review their application, set up the site visit, go on a site visit, take it to the board, get it approved. So it will take about a year, but you will start seeing within a year, you'll start seeing some of these programs get accredited. You'll see them out there. And the minute they're accredited, they'll show up on the ACEND website. They'll have their own page with their name and title and for people to contact them. So yeah, it's just like any of our standards. It's up and going.
Awesome. Yeah. And one question too is with the master's degree requirement, given that there is that baseline of a bachelor's degree or 4 years of experience, does that have to be where does the RD credential come into play? Because with a master's degree requirement to become an RD, is that bachelor's degree plus 4 years experience fizzling away or?
Yeah, so the reason we added the bachelor's with a 4 year experience because we did not want to deny all the RDs who got their RD with a bachelor's degree
Gotcha.
because we've got so many. I mean, that's going to take decades before we lose, those RDs leave the market. So that's why we wanted them to be included to have that chance to get a practice doctorate if they want to. But from moving forward, an RD is a master's degree. So it's just going to be the 2 years after you get your RD, you get the 2 year experience, then you can, then you can go for it.
Gotcha. Awesome. Cool. Just wanted to kind of flesh that out in case of people were interested in it in the timeline, but also bottom line is to apply for a DCN or that advanced practice doctorate, you have to be a practicing RD already for at least minimum of 2 years with the master's degree.
Absolutely. This is not meant to be entry level. I don't think dietetics is moving to doctorate entry level. We're not there. I know PT is there, pharmacy is there, but not dietetics. We're not there. It's going to be a few more years, I'd say maybe a decade or so before we even consider that one. Because we're just dealing with with moving to a master's degree and we have to deal with that and see all the repercussions and the changes with the master's degree. So so right now, there's no talk about moving entry level to a doctorate level, to doctorate degree. So you have to have that RD experience before you get into the practice doctorate.
Gotcha. Awesome. And then for the last question, and we've already kind of covered a lot of great things about the differences between a PhD and an advanced practice doctorate, what may be better for you or from choosing between a PhD or a DCN, but to kind of tie everything into a nice little bow for the people who have been maybe on the fence or still kind of mulling it over in their mind, what tips or advice would you give someone for deciding whether or not a PhD or the DCN / advanced practice doctorate would be a good choice for them?
Yeah, boy, that's a tough question.
Mm-hmm.
That's a tough one because they know themselves and they know what they need to do and what works for them. I say if you can do both, right? You're looking at the practice doctorate and you're looking at the PhD and you're like, well, I could do this one or I could do that one, and they both work for me. Go for the PhD, right? Because, right, I'm very ambitious and I'm going to tell you to go for always the highest level you can go. However, there are a lot of differences. One of them, PhD is a way of life. And you're in the school 5 years, sometimes 6. I know some that go 7. By 7, the university starts kicking you out. But it's a way of life. You're paid very little. But you're paid. You can afford to live those years, not poorly live. And it's a way of life, very free. You're still a student. You enjoy being a student and the student environment and being young, but also you're enjoying learning research. And if you love research, the PhD is for you. If you love inquiry, the PhD is for you. You enjoy statistics, you enjoy math. Those all are part of critical thinking, what the PhD requires. The PhD is for you. However, most PhDs, not all, are gonna, most of them in dietetics, a majority end up in academia. We all know academia doesn't pay a lot. So, but you're balancing money with a way of life. So that's the difference. For example, I raised my kids being an academician, and that was the only way I can attend their, their Halloween parties, right? I can do the library and volunteer at the library, do all the things that I could not have done with a 9-to-5 job. But I was paid. We always joked, if I was raising them on my own, I could have never afforded it. You're not paid very high, and it's a very tough job. So that depends. That low, not too much pay, but a great life, especially if you have a partner that can support the family in addition to what you're bringing. That could be a very good life because you're very flexible to be around your family and to do the things you need to do. The doctorate is the other opposite. It's a 9-to-5 job. You have a job, you're already in it, and not as flexible, most likely, unless you become a faculty. So then it's the same. But if you're at a hospital or in community or in public health, not as flexible. But man, you advance fast, you make a lot of money, and you can jump around and become a leader in different places. So what works for you? Money was never what motivated me. And the joy of advising and teaching was just so worthwhile. And it got me here. I'm not a university anymore. So eventually I did move out. But these are some differences. And I'm sure if you talk to other PhDs and other practice doctor people, they'll give you a lot more insight. But that's what from my point of view.
Which I think is a great point of view to have. And I'm glad that you ended on the talk to other people, because that is when it comes to making any big decision like that, that's why I love this podcast, is talking to people. It helps you make a more educated decision, and they also help push you towards making a decision, because you don't want to get analysis paralysis where you're just kicking your feet being like, well, should I, will I, all those types of things. But if you're actively talking to people, that's a great balance, because I think you're feeding your analysis that you want to do to educate yourself to make a good decision, but you're still doing action by talking to people who may push you towards other actions, or where they're like, oh, I'm not good at this, but I know this person who is. And then you just go on this talking train. And then before you know it, you hit this maybe epiphany where it's like, okay, this is it. This is the person I needed to talk to, or this is the information that I needed to have. So that's what I hope with these podcasts. And that's what I know has happened with the podcast that we've had together. And so thank you again so much for joining for, I think this is the 5th episode. I'm losing track because there's so many great topics that we're covering. And I'm sure with the stuff that ACEND is working on, that the dietetics profession is moving in a positive direction, especially when we have positive people like you and positive students that are in the education system and working to become RDs. So thank you again, Dr. AbuSabha, for all of your wisdom and all of those wonderful things. We may have other episodes with you, and we'll just see where it takes us, just like how a doctorate degree and a PhD tends to do. So thank you.
Thanks, Jenna. It's just been so fun to do these podcasts with you. And I just hear from faculty that the students are watching them, and it just makes me so happy. I just want to tell you one last thing to leave the group with us. I don't know of anyone who ever regretted having a practice doctorate. I don't know anyone who's ever regretted having a PhD. You know what I mean? That decision is going to be a positive one, whatever you do. So I encourage you and everybody else to make sure to continue that, pursuing getting higher and advancing. Thank you so much.